from Dr. Chiwokurafor. Okay, good. So I want us to just have this conversation now. I've been doing a research of late, trying to understand the benefits of molecular hydrogen, molecular hydrogen, benefit of molecular hydrogen. And I decided to send a message to Dr. Yawi, Dr. Chiwen. Please just help me also look it up. Let's have a conversation for like maybe 10 minutes to help people understand why molecular hydrogen. What is this about? What is this whole fuss about Ultra H2? What is it? Okay, I'll be talking about the Ultra H2, but before then, let's just have a conversation, free conversation about the molecular hydrogen. Dr. Yawi, please, what did you find when you made your research?
Right, thank you very much, Ambassador Dr. Elijah Mba. Thank you for the privilege. Good morning, House. When this Ultra H2 came on board, I went into research to look it up and see what it's all about. And I found that actually there has been studies, several studies on this, okay? Even though there's still ongoing studies, okay, on the effect. But one of the things I found was that the hydrogen molecule is very small, so it can actually dissolve inside water, okay? It can dissolve inside water. And I found out that it can cross the blood-brain barrier, okay? It can enter into the mitochondria of the cell. And then I found out that there has been research to show that it has anti-inflammatory effect, okay, antioxidative effect, okay, so it helps in exercise, it helps to improve endurance, okay. I also found that it has cardiovascular effects, okay. It helps to reduce cholesterol, and then it helps to improve the endothelial function of arteries. And especially it's most beneficial for smokers and a lot of other benefits. In fact, I was just going through now that it may have some anti-cancer effects in conjunction with taking the cancer therapy. It improves, it helps to reduce some of the growth of this cancer. So I'm still going through it. And then it has anti-diabetic effect. Okay, it helps in mental health and many other things that I saw.
Okay.
Thank you, sir.
Okay, Chief, you mentioned anti-inflammatory effects. You know, some of these people here, they are not doctor. You know, some people say the person made an inflammatory statement. Is it that anti-inflammatory effect means it makes people not to quarrel, not to fight? Because inflammatory people say, you are trying to make inflammatory statements and all that. So this inflammatory effect you are talking about now, can you relate it to maybe anything we can understand? Are there conditions that are associated with inflammation that so that we can relate? So that before people take it, they say, I'm not supposed to be angry, but the person made an inflammatory statement. I could not feel the effect. So what do you have to say about it, Chief? At least let's understand.
Okay, medically, okay, inflammation is when there is swelling, pain, okay, redness, okay. Let's say you hit a part of the body, okay, and immediately you start noticing swelling and then pain and redness and heat over that area, okay. Inflammation may also lead to fever. You know, sometimes you may have maybe an injury or infection somewhere, and then you have generalized fever and then body pain and all that. So this is what we call inflammation. So it can reduce these symptoms, okay? The Ultra H2, yes, hydrogenated water can reduce these symptoms of pain, fatigue, fever. Okay, so that is what we mean, what the inflammatory statement, yes, sir.
Yes, I think in those days, I don't know if it has changed, but I don't think it changes. They used to call all those things that ends with itis. They say they're inflammatory disease. Itis.
Yes.
arthritis, appendicitis, all the itis. Okay, so most of the itis, I don't know if there are some itis that are not inflammatory, so it has anti-inflammatory property. Thank you very much, and Dr. I will come back to you. Dr. Chinwe, please. What did you find out? Meningitis. Somebody is from cellulitis. These people know buko. Okay, so you are seeing, but once you see itis, okay, it's inflammation. And when they say it has anti-inflammatory effect, it means it can have protective effects, helpful effects against such disease condition. Peritonitis, mastitis. It's like some persons have started going to Google to go and find things that have itis, because I don't know where I'm seeing mastitis and peritonitis from hepatitis. Okay, that's pretty common. So, Dr. Chinwe, please, did you find anything? And if you found anything, please let's just learn from you. Yes, laryngitis.
Thank you.
Yes.
Thank you, Dr. Elijah. I didn't really, when you mentioned this thing to me first, I didn't know so much research had been done on this. I thought it was just one new thing coming out, but this research has been ongoing since 1975.
Wow.
In fact, hydrogen therapy was first noticed in 1975, although majority of the researches, the bulk of them have been done on mice. Some have been done on humans, but most of them were first carried out on mice. The first time it was noticed was when it was found to have anti-tumor effect, skin tumor. It was effectively treating skin tumor on albino mice. So based on that, that was now what prompted the further research that has been done. And a lot of research has been done over the years, a lot. So it's been found to be promising in neurodegenerative disease. And like this particular one has a place in my heart because of my dad has a neurodegenerative disease. So when I researched about it, I took the whole thing personal. So it's been found to show promise in the treatment of neurodegenerative disease. When we say neurodegenerative disease, some diseases that target nerve cells and start making them to die off. Things like Alzheimer's, dementia, Parkinson's disease. But aside that, it's also been found to have effects in cardiovascular diseases. That's all these cardiac, heart-related and blood vessel diseases like blood pressure issues, all these lipid-related issues, Then also metabolic diseases like diabetes, skin lesions, skin diseases, and also soft tissue injuries, even kidney diseases. And then generally, as you said, all inflammatory diseases like all the itis, arthritis, and the rest of them. So in addition to what our senior colleague, Dr. Yahweh, said, I came across a lot of things, what makes hydrogen special. The major issue with all these diseases, one thing they have in common is that they are as a result of oxidative stress. Oxidative stress is what happens when the brain is, or the body is released to all the pollutions we come across every day. Every day you come out, you're breathing something that you're not supposed to breathe. You're mistakenly eating or drinking something you're not supposed to eat or drink. So everything leads to oxidative stress in the body, whereby as in this oxidative stress, puts some stress on the mitochondrial function, and it leads to production of a lot of free radicals. Free radicals are things that, when very dangerous substances or particles, molecules in the body that result from all these things we eat, breathe, and drink. So the main work of hydrogen is that it reduces that oxidative stress. Okay. And then it mitigates, as in it kind of stops or reduces significantly the amount of free radicals that is being released from the mitochondria. you know. So it works, hydrogen on its own, because of what Dr. Yahweh said, because of the size and how light it is. It works very well on different parts of the body when it comes to releasing, fighting free radicals. There are some particular studies that showed some things that make hydrogen to be special. You know, a lot of research has been done to find out how to get an ideal substance or drug, you know, to fight these free radicals. But over the years, they have found out two things that limit most of the things that have come out. You know, it's either that the results are inconsistent, it will work on some, it will not work on others, or the people start developing side effects. So based on that, they now started researching for an ideal antioxidant molecule. And studies I came across show that hydrogen has been found to be the ideal antioxidant molecule. Because an ideal antioxidant molecule is supposed to mop up free radicals without disrupting normal body function. So most of these other drugs and other things, they end up having one way or another disrupting the body function. But because hydrogen is part of the body, you know, it just comes in, does its job as if nothing was there in the first place. So it's been found to be the ideal antioxidant molecule, you know.
Okay. We can't hear you. I don't know if it's me. I don't know if it's me. Is it me? Wow. Okay. No, we have to wait for her to come back. You know, it was even some of the things I have not personally personally researched yet, and you know, the idea antioxidants, you know, because I've been looking at it, you know, there are a lot of antioxidants. We have vitamin A, we have the vitamins, the antioxidant A, C, E, vitamin A, vitamin C, vitamin E. Some of us, we find them in our cream, especially vitamin E for skin protection. And they say just take vitamin C, take orange, just have vitamin C and all that. We have all the glutathione stuff and the all kinds of stuff, using antioxidants in the system. And but there are a few reasons. Let me allow Dr. Chinwe to finish so that I don't interfere with our line of thought. Okay, she's back. Thank God she's back. So Dr. Chinwe, please, we're learning so much from you before network took you. Please, welcome back. You can unmute yourself. Hello.
Can you hear me now?
Yes, we can hear you now.
Okay, sorry, please. I didn't know that I was logged out. Okay, so I was saying what made hydrogen to be the ideal antioxidant were some properties that they found in it. Number one is that hydrogen is one of the few molecules, one of the few antioxidants they found that it targets the most dangerous of all the free radicals. In fact, that's the only one that does that. It selectively targets the free radical called hydroxyl radical. Of all the free radicals, this is the most dangerous, or the most this is like the most dangerous, to use the layman's, that's normal English. So it selectively targets this hydroxyl and then mops it up. The other ones it works on, but this hydroxyl particularly, it selectively targets it and thus when it mops up hydroxyl, which is like the father of free radicals, it protects the cells. So what it does is that it will go and find this hydroxyl and binds to it and then convert it to water. So unlike other ones that work in different ways, after everything, they now have side effects and everything. Water, it converts it to water, which is also a part of your normal body.
So like I said, 75% of the normal body.
Yes. So it comes and does its work as if it was never there in the first place. So it will just find the father of the free radicals and convert it to water, which is safe for the body. Then secondly, because of its very, like Dr. Yawe earlier said, that it has the smallest molecular weight and is the lightest, it has the lightest mass of all compounds we know, molecules we know. So it can rapidly diffuse across membranes because of its tiny size. So it easily reaches sites that other ones cannot reach. It goes round, it's everywhere, it just goes everywhere. It's the smallest, so it has access to every part of the body. Then also it is lipid soluble. So this is particularly good for nerve-related issues. Because it's lipid soluble, it can enter the brain, it can enter the nerves, it can enter everywhere, the spinal cord, the heart, the lung, the liver, intestines, In fact, this hydrogen-rich water particularly has been found to relieve arthritis symptoms, which is one other thing that other hydrogen forms has been lacking in, So I think at this point I will hand over. I've also found out that, one other thing it does is that it balances the metal ions in the body, things like copper, zinc, iron. When you have excess or deficiency of them, it can affect the mitochondrial functioning. So this hydrogen molecule actually has a way of working on all these metals in the body to make sure that they are at just the right quantity that the body needs. So there are a lot of things it does, and I think you just talk more on it. But for hydrogen molecule treatment, the ones that have been researched most of the time is inhalation. Majority of studies were inhaled. They say it's found to be the fastest when it comes to functioning, and somehow it's the most effective. But the demerit of it is that you need special equipment. You can't treat yourself with hydrogen inhaled gas at home. So that is where hydrogen water now has a superior, superior to hydrogen gas, because it's convenient. It's water. Everybody has access to water. You don't need to go to the hospital to get the water. Something that, I forgot to add. Do you know that a study was done on people with Parkinson's disease? And they found out that the fact that they're even drinking normal water, the hydrogen in the normal water that they drink, they just told them increase their water intake, was found to be effective. They now say, how much more when you now have a hydrogen-rich water? It was shown to have some effects, they showed some level of improvement. So that was what now triggered their attention. If this low concentration of hydrogen can cause this amount of improvement, how much more when you now have water that is rich in hydrogen? So at this point, I think I'll just hand over to you.
Ooh. Okay. Two quick ones. First of all, I have good news on how to generate hydrogen, inhalable hydrogen, and we'll talk about that later. But you mentioned neurodegenerative diseases. Some of us might not understand that grammar. Even me says sometimes I try to. Can you give us one or two common example of neurodegenerative diseases that every person can understand?
Okay, so I explained it earlier that neurodegenerative diseases are diseases that target nerve cells and destroy them. We have things like Parkinson's disease. I'm sure people have heard of Parkinson's. We have dementia.
Okay.
We have
Thank you.
Alzheimer's.
Thank you.
So
thank you. Please, before they give the glory to Dr. Aritamba, it's not Dr. Aritamba. Dr. Chinwe, you see why you are supposed to show video? After you have given plenty information, bamboozle everybody. It has to be Dr. Aritamba, because Dr. Aritamba is one that also bamboozles everybody. If Dr. Chinwe Ujimadu is not Dr. Aritamba, please give the honor to whom the honor is due. They already prayed for Dr. Aritamba. We pray for Dr. Chinwe so that just channel it and say, God bless Dr. Chinwe. Okay, so that was so loaded from Dr. Chinwe. And she mentioned one of the demerits, because people were saying you are mentioning the advantage. What are the disadvantages? She mentioned one of the disadvantages that you can't just easily access. You need the machines that can generate the hydrogen gas. That is one of the major disadvantages. How do you assess it? Dr. Yahweh, please, do you know any other disadvantage that you came across of hydrogen-rich water as you were doing your own study? Did you come across anything? If you did not, just say you did not. If you did, just tell us.
I did not. So the only disadvantage is if there's any disadvantage in drinking too much water, then that may be the disadvantage. But I didn't come across because it's just water enriched or super saturated with hydrogen ions.
Okay. I don't know, Dr. Chinwe, Dr. Yahweh, did any of you come across any place where they documented maybe a required dose or concentration of hydrogen molecule in water that can have some of these effects? Did you come across anything yet? Or minimum required dose? Or
yeah, I saw all those things, but I didn't write them down. I saw a lot of in fact, okay, while you're talking, I think I will try and see if I can locate that one that was done on people drinking normal water and that low concentration that worked. So if that's something as low as that works, anything higher than that, I think is should be, at least that is the minimum required dose. This is just normal water, But as for the side effects, like our senior colleague said, Dr. Yahweh, I did not, the only thing I came across was just that issue of reduced sodium in the body that can come from taking a lot of water. It's still being researched, but somehow it's been found that taking the water, hydrogen water is still safe compared to other hydrogen forms. There are actually hydrogen injections. So, yes, there are. So that's just basically.
Okay. Thank you very much. So any final words? Dr. Chinwe first, then Dr. Yahweh, before I proceed. Any final words? Dr. Chinwe first, then Dr. Yahweh.
Okay.
Dr. Please introduce yourself so that they will know that you are not Dr. Arita. They are praying for Dr. Arita so that angels not carry your blessing and take it somewhere else.
God, please, my name is Dr. Chinwe Ujimadu. I'm a consultant ear, nose, and throat surgeon in Abuja here.
Okay. Okay. Yeah, so continue. Give us your last, any final words.
When it comes to, there are different diseases that this thing has effects on, but when it comes to diseases that medicine can do nothing about, we are limited. Things like cancer and all these neurodegenerative diseases. If there's anything that might show promise, I think it's worth exploring. That's just what I feel. Anything that would, because for cancer, everybody knows how cancer, there's like a cancer surge right now. The role of hydrogen rich water in cancer is still being studied, but I feel it's something that should be explored for what it's worth. Now, for neurodegenerative diseases, the bad thing about it is that it continues. Nothing can be done to stop it, So it's just something that as the years goes by, it just keeps getting worse. So this has been shown to it. There is no study that shows that it turns back the hands of time, to change what has been done. But for the further progression, it's been shown to slow it down significantly, compared to other drugs. I know how many drugs my father is on right now, and each one has its own side effects. So if I have an alternative to those drugs that will do the same thing, may even do more, and have little or no side effects, I think I'll opt for that option. So I feel this is a good, it's something that is worth studying very well, and if it works, then it's going to be good news for a lot of people.
Wow. Wow. Thank you very much. Thank you very much for sharing your final thoughts with us. Dr. Yawi, please, any final thoughts?
Yeah, I just remembered also that it has an anti-aging effect. So, we plastic surgeons, we are interested in how to make people look nicer, look better, okay? Be the ultimate version of themselves physically. All right, so I think that's another area one should explore, the area of anti-aging. So it says that everybody should be part of this. I mean, should be part of this ongoing study. So let us be the participants in the future study, okay? They will see the effect in us, okay? And then this can also be documented. And then I also saw that it has some effect against radiation injury. So even these high temperature levels now, so it's also good that one should be taking a lot of this. And then those who are maybe on cancer therapy, on radiation, this water should be part of their water. And then I saw that the effect of alkalinized water that they were talking about in renal injury patients, in patients on dialysis, that this effect is actually because of the hydrogen ion. So it's actually the hydrogenation of this water that actually gives that effect. So that also tells us that this is a very good development, and it is, as Dr. Chinwe said, it's ongoing, and it's like we're even far behind. We didn't even know what has been happening in the world. So thank God we're now in the mainstream, and we have this opportunity. Thank you, sir.
Wow.
Sorry, Dr. Mba, please.
Okay, yes,
one
please.
Of the, it's not really a side effect, but that was one of the demerits of hydrogen water.
Okay.
All over the world, people are complaining of the price. So that is one other thing that should be looked into.